In the early 1980s, there was an emergency room doctor named James Broslow. Dr. Broslow noticed that during patient care, there was good care being given to adult patients. But when children came to the hospital, there were sometimes problems with healthcare providers confidently and consistently treating child patients because of their differences in size and weight. And sometimes this ended up causing delays in treatment or errors in medications or equipment used to treat the children. To help solve this problem, Dr. Broslow developed a color-coordinated tool that uses length as a measurement to obtain a patient's weight, and then be able to determine the medications and equipment that can be used using that tool. It was called the Broslow tape, and it quickly became a standard in pediatric care in hospitals, ambulances, and healthcare facilities nationwide. Hi, my name is Carol, and today I'm going to introduce you to the Broslow tape. I'm going to cover what is a Broslow tape, why is it important, where you can find it, when you can use it, and how to use it. So, most of you know me. If you don't know me that well, I'm a paramedic, and I used to work on an ambulance before I came here. And when we had pediatric patients, the Broslow tape was very handy because time was short and you were under pressure. So it ended up being a very useful tool. And as most of us here work in the emergency room, we will eventually have to treat a critically sick or injured pediatric patient. And sometimes the stress and anxiety can build up during those times. So why not allow the Broslow tape to simplify and assist you in those situations? So we'll start with, what is a Broslow tape? This is a Broslow tape. It is a folded, laminated, color-coded tape. It unfolds easily. It is also laminated, which makes it easy to clean. However, if it is contaminated with blood or body fluids, it should be replaced. It is organized by color, and it is meant for children who are 12 years old or younger, or under 36 kilograms. And it uses length as a measurement for weight, and includes medications and equipment listed for each color category. So why is the Broslow tape important? It's important first because it helps reduce errors in pediatric care. Since the weights of the pediatrics are already calculated, and the medications are pre-calculated, which are usually in milligrams per kilogram or milliequivalents per kilogram. You don't have to do the math. And it also helps reduce error when it comes to equipment sizes, because a lot of pediatric equipment is also measured, like airway devices could be measured from the nose to the earlobe, from the mandible to the crease in the mouth. If you're using an endotracheal tube, you might need to do a mathematical equation. All that stuff is listed on here already, so you don't have to try to figure it out. Where would you find the Broslow tape? The Broslow tape is in several different locations. Paramedics carry the Broslow tape on the ambulance in the Broslow bag for pediatrics. We also keep a Broslow tape on the pediatric crash cart. The crash cart also has color-coordinated drawers that would correspond with the colors on the Broslow tape. So for each color on the Broslow tape, there's a color-coordinated drawer on the Broslow cart, and also in the pediatric Broslow bag that we keep in the emergency department. When would you use the Broslow tape? You could use the Broslow tape for pediatric emergencies, since we know that pediatrics have special needs. They're not just tiny adults. They metabolize medications differently, and they have all different kinds of, children come in different sizes, and they all have different weights, not like an adult that varies so much. Also in pediatric trauma, according to the Brady Paramedic Emergency Care book that I used in paramedic school, accidents are the leading cause of death in children 1 to 15 years old. So pediatric trauma, you may see some of that. And also, if you just want a quick estimate on a weight or a vital sign, this can be used in any child that comes into the emergency room. Some pediatric Broslow tapes include vital signs on them. how would you use a Broslow tape? This is my last point. First, you want to take out the Broslow tape and decide what side you're going to use. Most Broslow tapes have a side that are meant for cardiac arrest and resuscitation. The other side would have medications for medical emergencies such as overdose, seizures, IVs, stuff like that. You would lay the Broslow tape down on the table. Once you decide what side you want, I got my little baby here, you would lay your child down with the head right next to the red arrow that's on the top of the tape, and you would measure where the heel touches the tape. Make sure you're measuring from the right end. It can sometimes be a little confusing because there's so much blank space up here, but the colors start down at the bottom. But however, you'd be measuring from the top where the red arrow is. And where the heels touch on the tape would be your color. So the baby would be on the gray area. Just make sure that you're not measuring where the toes touch, is where the heels touch, because you could get the wrong color. Now you are ready to use the Broslow tape. We've covered what it is, why it's important, where you can find it, when to use it, and how to use it. Hopefully now, if not already, it'll help you be confident and more comfortably do patient care. Whether you're new to patient care or you're experienced, just want you to know that Broslow tape can make a difference in time and help reduce errors and overall help do better care for pediatrics in the emergency setting. Thank you for listening to my